electronic medical record, IT management. He brings expertise in strategic IT planning, governance, and technical aligned ICT experts to achieve the needs to go. Round of applause to Mr. Bui, please. Let me also call upon Mr. John Mahundi. So Mr. Mahundi is a head of technology and data analyst at Presidential Delivery Bureau at the President's Office. Mr. Mahundi has nearly 20 years experience in digital space. He leads digital transformation innovatives for President Dr. Hussein Ali Mwinyi, and his work focus on key sectors like tourist, infrastructure, the economy, and social services, delivering information and advanced Zanzibar development through digital solutions. A big clap for Mr. Mahundi. Then finally, we call upon Mr. Severus Elomo. So Mr. Elomo is a director of Information and Communication Technology for the Ministry of Health, Tanzania mainland. He is a senior system analyst with a 10 years experience in health sector digital transformation. He has overseen development of digital health strategy for mainland, enterprise architecture, and policy development. His leadership has shaped the country's digital strategic direction and in health innovation and adoption of digital solutions. Let's have a clap for Mr. Ilomo, please. So we are discussing upon leveraging innovative digital solutions to enhance quality healthcare services in Zanzibar. But let's look at the background. The rapid technology and advancement and digital solutions offer transformative opportunities to improve healthcare quality. Zanzibar Ministry of Health is committed to adopting innovative digital solutions to enhance patient care, streamline healthcare delivery, and improve health outcomes. This forum, we are going to discuss on how digital solutions can be used to improve the quality of healthcare services. So the panelists will discuss and give some insights on how far the implementation has been. So Mr. Khatib is going to be talking about digital implementation and the impact, challenges, experiences, and the lesson learned. But Mr. Elomo will talk about experience of similar initiatives happening in mainland. But Mr. John Mahundi, as a top leading at the Presidential Delivery Bureau, will share how government is committed to make sure availability of resources, but the proper implementation of digital solution to realize the quality of healthcare services in Zanzibar. So, let us start with Mr. Khatib. Mr. Khatib, the Ministry of Health has developed the first Zanzibar digital health strategy in 2020. And so there's 3 questions you need to answer them precisely. Can you please share some of the progress and achievements since the implementation of this strategy? But also, share the current telemedicine project. How far is it? And finally, tell us how telemedicine services could potentially serve the rural community and remote areas in Zanzibar.
Thank you, Mr. Mohammed. Good morning, everyone. First question is about to say something about equitable health strategy. The strategy developed in 2020 aimed to go up to 2025, and the strategy was having 8 strategic objectives with 25 strategic initiatives, and currently is about 40% of the implementation already completed, and 44% is ongoing, and 16% not started yet. And among achievement is to implement or to install fiber connectivity to 10 district hospitals, whereby currently outsourced provider they are providing health services. Also, development of governance documents, including all bodies, including steering committee and technical working group, has been established. And also, some policies have been developed, including ICT security policy, data management standard, and so on. But currently, the ongoing project include human resource information system, including health facility registry. Those initiatives that currently is going on. Those who are not started, including the establishment of digital health directorate and automation of 142 health facilities. In terms of telemedicine, Ministry has set a pilot hospital to start telemedicine services. And this hospital is Dala Mzee Hospital, which is in Pemba, Mnazi Moja. Here I mean Mnazi Moja in Dala Mzee, one item, and Mnazi Moja to telemed with Moi and Jakaya Kikwete Hospital. So currently the progress, mostly the implementation of this solution is on high level, in high percentage achieved, because there are some UAT already conducted between Mnazi Moja and Moi, and process is underway to finalize installation with Abdallah Mzee and Mnazi Moja. So Ministry now is planning to do comprehensive UAT for telemedicine between Mnazi Moja and Moi. Thereafter, there will be a training for workforce. I mean those who are going to use the telemedicine, providing awareness. Those already in plan, because without awareness, client will not believe the service that is provided through the telemedicine. And also, currently, development of SOPs and guidelines is going on. Hopefully, by 3 months to come or 2 months to come, those issues will be completed and the system will be in live operation. Another question was benefit on this telemedicine or potential. Normally, Ministry of Health facing challenge of human resources. So whenever telemedicine implemented, it will help to reduce this gap because those consultation and diagnostic will be provided without presence of staff to the identified health facility. So remotely, client will get consultation diagnostic without traveling long distance or without traveling. Also, it will reduce cost in terms of families because family they have to use transport to follow treatment or to get medical service. But by implementation of telemedicine, they will be able to reduce the cost because they will not go to follow the hospital. Also, the government will reduce the cost because nowadays, when there is a case which is beyond the referral hospital here in Zanzibar, they are supposed to refer to mainland or even abroad. So, whenever telemedicine implemented and used, client will get local services here or consultation without traveling or use their money. Thank you.
Thank you so much. Thank you so much, Mr. Buyu. And this is amazing because you can see that in the past 3 years, the government has been able to implement digital strategy, completed initiative like 40% and like 48% is a good progress. It's just a few initiatives that are not yet started. And the telemedicine services, which is going to be helping the provision of specialized services in the remote area. This is amazing. Now, coming to Mr. Ilomo, can you please share your experience in the implementation of telemedicine in a similar setting, maybe, please?
Thank you, Moderator, Mr. Mohammed. Basically, the case with telemedicine is not that much different from Zanzibar, but basically, Tanzania mainland, what we did is we started telemedicine as a pilot in one of the facilities which is very remote, called Sokwan. It's like 800 kilometers to 900 from Dar es Salaam. So we started by connecting that facility to Mundiri for taking a look on radiology services, because as you know that one of the understaffed area in the health sector is availability of radiologists. So we started by making sure that images which are taken from Sokwan are directly sent to Mundiri for making some medical translation, whatever, so that those patients are not supposed to travel using their resources from Sokwan up to Dar es Salaam. And then later on, after a successful implementation, we move on by engaging some district hospitals, by connecting some of the district hospitals with regional referral hospitals. As you know that modality of referral in Tanzania mainland started from the primary healthcare level to regional referral hospital, then zonal hospitals, specialized up to national hospitals. So what the next step we did, like connecting these district hospitals to regional referral hospitals, make sure some of the services that we see, this could be maybe a problem for most of the patients that are attended at the district hospital. We connected the regional referral hospital by making sure consultation are made and results are turned back to the district hospital. And as of now, we have already connected 16 regional referral hospitals with 184 district hospitals in telemedicine. And basically now what we did is we established what we call telemedicine hubs to these specialized hospitals like JKCI, MOI, Mirembe, those specialized service hospitals, to make sure that those patients can be attended from where they are, rather than move them from the PHC up to this specialized hospital. But also we have established a hub center at Muhimbili National Hospital for those high-level services to make sure that zonal regional referral hospitals will now communicate with the National Hospital for services which are not of the level, to ensure that we are avoiding this burden of our patients moving from the regional referral hospital and the zonal hospital to national hospital. I think that is what we did for Tanzania mainly.
Thank you so much, Mr. Edomo. This is interesting. You pointed about diagnostic services. My fellow doctors, can we treat patients without diagnostic? You can't, yeah? So it is amazing to see this interesting initiative of the government pushing their telemedicine. Now coming to Mr. John, I see the government of Zanzibar is very serious in implementing telemedicine. What is the expectation of the government? What is going to be the outcome, tangible outcome for the government from these initiatives?
Good morning, everyone. Assalamu alaikum. So when you think about it, a lot of what has been discussed has been more providing support from a health facility to a health facility. From a strategic perspective, the president would like to see us go beyond that. Right now, you still have to take a patient from their home to go to the facility to be able to get the service. Yes, it's a benefit that we're gaining by cutting down the referrals that you will take from Zanzibar to the mainland, but what can we do to even cut down that initial trip for the patient to leave their house and be able to still access telemedicine services? That would be something that we absolutely have to get to and have to unlock. There are a lot of different partners that are willing to help us in this space, and the building blocks are there, right? So we already have started providing the telemedicine services within the facilities, so the infrastructure and the systems are there. Now is how do we connect the dot from that to the patient so that the patient does not have to live from where they are. I think if and when we achieve that, that will be the goal that the president has in this space from a telemedicine perspective. It's not just about cutting down the cost, but it's also making sure that we are providing quality service to our people. And the response time to attend to a health situation is key. You don't have the time in some situations. You don't have the time to take the patient to the facility, from the facility, have the services and communication between mainland and Zanzibar. We're trying to cut down that response time as much as possible so that we have the right diagnosis and we have the right responses for them.
Thank you so much, Mr. Mahondi. This is going to be an interactive session. When we finalize with them, we get opportunity for you guys to answer questions. But let me first go back to Mr. Ilomo. The WHO Global Strategic Digital 2020-2025 emphasizes the importance of governance and digital health, which aims to strengthen the capabilities and skills needed to countries to implement digital solutions. Can you provide the international perspective of the digital transformation and the best practices in Zanzibar, in Tanzania?
Thank you, moderator. Basically, Tanzania is not an isolated island. Tanzania is a country which collaborates with other countries. So all of us, we know that WHO is a global moderator for the health perspective. So we as Tanzania also, we are collaborating with such organization to make sure that we adopt international perspective, which would be a benefit for our country. Back to what you have mentioned with digital health, what I can tell is one of the best digital health strategy I can say in Africa is from Tanzania. Yeah, so you can see most of the African countries now, they are trying to read what we have done. So we developed our first strategy 2013-2018, which and then we ran an assessment to oversee the implementation of it, and then we scored like 55%. But unfortunately, we came to realize that we were not much achieved because our strategy has contained with ambitious goals. Is most of the time when we developed the strategy, we didn't think about the gap that we have in terms of infrastructure. as you know that infrastructure is a foundation. Whatever I want to do with the digital health without an enough for proper infrastructure is somehow a big gap. So we found like we didn't achieve most of the goals because of unavailable proper infrastructure. And then we came 2019, 2024, we developed another new strategy. And then now we are in a process of doing assessment what we have done so far with it. But we found like we moved from 55% to 60%. So you can find that we have an increment to achieving of our goals as we improve infrastructure, we improve development of our digital solution, and our development started basically aligned with WHO that WHO has given us with a global strategy which should be adopted with other countries to ensure that there is an alignment between countries and the WHO. So you may find in that perspective, Tanzania is a proper aligned with the international perspective. But second, as you know that most of the countries in Africa are implementing digital health solutions, and if you go and find in the global digital health monitor, you'll find that Tanzania has been scored 4 out of 5, which is 5 is the highest, and we are in 4. So we find that our group is we score the same with countries like Qatar, Thailand, and other big countries which are really developed more than us. So we find that kind of recognition in a global digital health monitor is a key for us to see how we are collaborating, how we are participating in international perspective. Thank you.
Thank you so much, Mr. Elomo. It is amazing to see that Tanzania has developed the first digital strategy and then finalized the time, and then the second digital strategy, which is now continuing. And Zanzibar as well has developed the first digital strategy, and we are now in the 3rd year of its implementation. Let me also go back again to Mr. Khatib. I know infrastructure, technical know-how, and change management are very crucial in realizing the digital transformation. And some of the doctors, sometimes we don't like to use digital systems. How are you planning to make sure that providers are using digital systems? And then, what are the technical challenges that we're facing now? And what are the plans in place to resolve the challenges? Please, Mr. Hadi.
Thank you, Mr. Ahmed. First question was how we ensure the service provider they are going to use digital solution. First of all, the most important here to ensure the service provider they are using digital solution, the most important is to manage change. First of all, we should have plan or framework to manage change, because this is the change from manual to digital in the change. So we should prepare those service provider to know what we are going to do, to give them the benefit of this change for the better service delivery. That's the most important. Second one is the awareness. We're going to ensure that awareness is there. So either by circulars, memos, things like that, or using this digital platform, because most of our doctors they are using WhatsApp. So we can send the awareness document to the WhatsApp group. I think even in the ministry there is one group called as Tumisha, if I remember. So we can send there. But secondly, we must have or implement solution which is user friendly. Because if you give the system that is not user friendly, then definitely they will resist to use it. Second, another one is involvement of the user in the development of any digital solution. Because if we don't involve them, they feel this is not part of our duties. So they don't accept the system. In line with that, it means we should have provide proper training. We have to put them in the class and give them the training. Thereafter, after the system is implemented, then we should have proper technical support. That's the most important. Proper technical support. Then we should have those I think the most important apart from other areas. But maybe to add on that, having reliable connectivities, because now systems are accessed remotely, maybe the database in Zictia, then people from Pemba they are accessing, so we should have reliable connectivity, and to add on that, we should have backup connectivity. So that's also most important, because if the network every now and then is not there, it's down, so user definitely will not be happy and they will resist to change. They will say, it's better to write on our book. Okay.
Yes, absolutely, you are very right. I think we need to make sure that users are getting convinced in using the system, from supporting them, from giving them user-friendly solutions, and from making sure that systems are available to make sure that they are using them. Otherwise, they go back and use their papers. Now, let me jump again to Mr. Mahundi. The implementation of digital systems requires a huge amount of money, huge investment, especially at the beginning. And the government has tried the best, but in line with a lot of different other priorities, cannot make sure that we are covering everything. How is the government committed and is ready to make sure that they're investing seriously in the digital solutions to realize digital transformation in Zanzibar?
So from that perspective, definitely for us to succeed in the digital transformation side of things, the investment, the financial investment is definitely important. The one thing that I can say we're blessed with the health sector space, we're not short of people who are willing to support us financially, from a technical perspective. So there are a lot of partners who are ready. It's just a matter of us organizing ourselves and making sure that we are managing our stakeholders in such a way that we are optimizing the investment that's coming into the Ministry of Health. But apart from that, the government has budgeted a significant amount in the digital health space, but we will rely on partners and PPP arrangements to ensure that we are getting additional resources that we need to achieve this, but not only from a financial perspective, but also partners who can team up with us on the technical side, so that when we're rolling out our systems, they are actually rolled out in an optimized way, they're actually available 99% of the time, so that we don't actually shoot ourselves in the foot with the things that we're rolling out. So to answer your questions, financially, we do have money allocated, but we also are depending on our partners, and both development partners and implementation partners, to jump in on the journey to us.
Thank you so much. A follow-up question, please. The ministry has so far implemented around 75% of the current digital strategy, and we are away for some months before the end of the current Zanzibar digital strategy. So my question is, are you sure that you are going to complete implementation of this strategy in its time, 2025?
We're doing everything that we can to make sure that happens. So there is weekly touch bases, touch points that we're having with all stakeholders in the digital space specifically. So our people who are managing and operating district hospitals, regional hospitals, safety, MSA, and the likes. teaming up with the Ministry of Health to make sure that we have a clear roadmap of what we're trying to achieve at the end of 2024. Specifically, at the end of 2024, we wanted to optimize the patient journey. We want it to be where you go to primary healthcare, district, regional information is easily transferable between those layers, but also within the hospital itself, when you're moving from the lab to the radiology, your information onto the pharmacy is also able to be seamlessly accessible so that we don't have pockets of paper and digital systems operating at the same time. We are set to achieve that before the end of the year, and I'm very optimistic that we will be able to.
Thank you so much. Additional follow-up question. During the implementation of Zanzibar digital health strategy, there are a lot of changes that had happened, and we would expect that the Ministry of Health to have reviewed the midterm review of the strategy, making sure that the implementation should follow with align with the new changes. How sure are you with the current strategy is going to achieve the objectives, incorporating the new changes that has happened?
So the strategy is not a static document. It's not something that is not going to change. We actually pay attention to the things around us and make sure that we're adopting the changes to accommodate those changes in our strategy, right? So to answer your question, there is, because it's an agile process, because it's a dynamic process, as we are receiving and understanding the changes around us, we're incorporating that into the strategy as well, to make sure that whatever we had set out to achieve, we're still able to do it.
Thank you so much. Now coming to Mr. Ilomo. Innovation has become a famous term. What is your perception about digital innovation, and how is the Tanzania going to roll out digital innovation across the region of Tanzania?
Basically, I think what we best move with is like a collaborative approach. What we are doing is to make sure that we engage all parts that we see could be maybe take some responsibilities, because we know that governments could not do everything itself. So what we're trying to do is we make some mechanism to make sure how we engage the private sector, how we engage NGOs, how we engage funders. So it's a 360 approach where we are trying to look in each role where we expect to have certain achievements. What we are supposed to set is a benchmark to make sure that we are reaching the goal that we have targeted. So in Tanzania mainland, we always do that to make sure that whatever we want to do, we engage all parties, Ministry of Science and Communication Technology, Ministry of Health, the President's Office, regional section of government. So all the parts to make sure that what we are set as a focus, we set a focus as a ministry, we set a focus as a country, so that make sure we reach the goal that we are targeting.
Asante sana, Mr. Ilomo. You know, this discussion needs to have like 3 hours, yeah? We cannot discuss everything here. But let me go back again to Mr. Mahundi before I allow audience to put their questions. Mr. Mahundi, the government of Zanzibar has promoted PPP, public-private partnership, to provide quality healthcare services. Health data remains to be a crucial asset for informed health decision and improved quality of healthcare services. Explain the role of PPP in the implementation of sustainable digital solutions, and then also explain to us the role of data driving a quality improvement in healthcare services.
So to start off with the PPP, I think for those who were there in the previous sessions, the reason why we have the public and private partnership is so that we can close a gap where we are short on financing, short on technical resources, and creating a win-win situation for all parties. So when somebody is ready to give you money, they probably want to return for that money at some point. And a PPP structure allows that to happen, where people can actually still help provide funding and do business at the same time. From our end, we're able to get the services that we need and get to the desired outcome that we set out for ourselves. So the PPP structure helps facilitate that side of it. And then when you think about it from the other side of data, today, if you are a leader in the Ministry of Health, you have to make critical decisions. How do you make those decisions today, right? In some cases, Muhammad has all the information, or Buyu has all the information, so you have to call Buyu to find out what's going on in the individual's face, what's going on, how many patients have come in, if you're trying to track diseases and trends of diseases, how do you take a look at all those things? So optimizing the data structure and data accessibility is going to empower leaders and people in the Ministry of Health to ensure that they're making informed, data-driven decisions versus opinion-based decisions, right? So if I call you today, you're going to tell me one thing, and then if somebody else calls you tomorrow, you might tell them something different, where the data is pretty straightforward. So what we need to do is optimize our data systems and access to data for the leaders and all the people who need to make decisions from the data that we have, but not only in the current situation, but also proactively, being able to see things that are coming up ahead of us so we can plan better, optimize our deployment of resources, and also be able to capitalize on saving people's lives, which is our primary responsibility with the Ministry of Health.
Thank you so much. Before I give the audience question, I go back again to Buyu. What is the lesson learned after 3 years implementation of the Zanzibar digital health strategy?
Okay, thank you, moderator. During 3 years implementation plan of digital health strategy, there are a few things I have learned there, and one of them is stakeholder engagement is very important, because their contribution and advice will, of course, will help a lot to implement this strategy. Then there's a issue of awareness. It's a fact that there is no enough awareness to stakeholders, especially health workforce. They don't know. If you go to someone and ask, do you know digital strategy? They said no. The same case goes even to higher authority. You do something and then it's like it's not within the strategy. So it means there is no proper awareness to this workforce. Also, there's a need of financial resources. Financial resources is very important, because you can't implement anything without finance. Another one, there is the importance of having monitoring and evaluation to see how we are going with the strategy, where there's a problem, how to fix, or to review before 2025, because now it's guys or specialists for the policy and strategy, they are using the word rolling. So I think it's important to review, to see where the problem, which one's supposed to be rectified, and produce new initiative. Because as now, let's say we have outsourcing services, but in this strategy 2025, there is no issue related to outsourcing. So if we're having monitoring and evaluation for feedback, then it was supposed to review and having item related to outsourcing, and then it will go not from 25. If we review today, it will go to another 5 years. Thank you.
Thank you so much. Thank you so much.